This is the part of the program where I'm going to invite you to go to a place, if you haven't already, where you can be as comfortable as possible, allowing yourself to have a place that you can be propped up. If you want to stay awake and really learn these particular tools, it's helpful not to be lying down completely, but so you can lean back, put your feet up, really allow yourself to just let go. You don't have to be looking at the computer anymore. And if you're not there, I welcome you to come back when you are. So these assignments will be one after the other. And if you want to stop and practice one of them, you can. You can listen to them all the way through and come back to any one you want when you're ready. And before we begin, I just want you to notice that you're in a place that's more comfortable for your body, and that your body is welcome to move in any way you need it to move, or it wants to move, to feel even more comfortable. You don't have to hold yourself still. You can let your body move. As you remember that help is on the way. And I'm going to begin with the first one, which is body scan breathing. And it's based on an exercise that comes from Maggie Phillips, Dr. Maggie Phillips and Peter Levine in their book, which they call circle breathing. So I'm just going to invite you to breathe and begin to sense into your body just a little bit more. Just noticing your body. And noticing places where you're more comfortable and not as comfortable. Places that might be loose and places that might be tight. Different sensations like prickly or warmth or pulsating. And you might be having some reactions to this, but just noticing it and allowing it to be okay for you to be breathing and fully inhabiting your body. Locating the most comfortable side of your body, see if you can notice which side of your body is the most comfortable. And if they're both equally comfortable, then you can just choose one side of your body. And we're going to be doing some breathing and imagining breath moving through your body, beginning with the most comfortable side of your body, up through your foot, up your leg, and down the other side. So let's try that. Finding the most comfortable side of your body, breathing up from your foot, up your leg, on the most comfortable side of your body, into that center of your breathing, which is usually right around your stomach. Just breathing up that leg and then breathing down the side of your body, down the leg, out the foot of the less comfortable side. And again, breathing up from your foot of the most comfortable side of your body, up into the center of your breath, and then back down the less comfortable side of your body through your foot. And just allowing yourself to notice and accept any thoughts or responses you may have to breathing into your body. And now we're going to imagine that you have a magnet that's attached to the breath and the comfort, and begin again with the most comfortable side of your body, pulling the breath like a magnet in through your foot, up your leg, bringing the comfort with it, pulling it up through your leg, up to that center of your breathing and crossing over, and then pulling the comfort back down the other side of your body, out through your foot. And again, like a magnet, pulling the comfort with your breath up through your foot, up your leg, through the most comfortable side of your body, crossing over, coming to your center, and then going down the other leg, pulling the comfort through and down and out your foot. And you may already begin to notice some changes, some increase in comfort. But if you don't, you can try the opposite way, forgetting about the magnet and just going back to breathing, and breathing up through the less comfortable side of your body and down the more comfortable side. So you may want to try it just to see what it's like, even if the other way was already helpful. So just now with breath, up, coming up from the foot, up the leg, through the less comfortable side of your body, crossing over, and going down the more comfortable side of your body. And try that again. Breath up from the foot, up the less comfortable side of your body, and down the more comfortable side of your body, out your foot. And see how you like that, how your body likes that. See if that increases your comfort. And sometimes you may be experiencing some discomfort in the upper part of your body. So with that, we try, even if you are completely comfortable in the upper side of your body, you might want to try it anyway. Breathing up from that center, up your midline, and down your shoulders, through your back, base of your spine, and out. And let's try that again. Up from that center of your breathing, up and down your shoulders, down your back, just lengthening and strengthening, and just out, right around your sit bones. And then try that one more time. Up from the center of your breathing, up your midline, and then down your back, down your spine, and out the base of your spine. And you can continue to experiment and play with this using the magnet, bringing the comfort up from the front side of your body and down your back, and see what helps you feel the most comfortable. So now we're going to be moving on to this next somatic experiencing tool is another type of titration. So just noticing a part of your body that may be more comfortable or neutral. And just breathing and noticing this part of your body. Again, thinking, help is on the way. And just breathing into this more comfortable and neutral part of your body, seeing if you can notice the very edges of the comfort, the place where it's not real comfortable, but it's still within the comfort zone, the very edges. And just begin to be aware of that. And just breathing, allowing your body to move if it wants to move, and noticing the very edges of the comfort around this comfortable or neutral area. And now I want you to begin to experiment with a less comfortable part of your body. So locate a place in your body where you may be noticing some discomfort, and just breathing into that and noticing that, but not focusing on that, pulling back a little bit and just noticing the very, very edges of the discomfort, the very outside, and just allowing yourself to just be aware of that and just breathing. Not the center, the very, very outside. And if you're noticing some emotional reactions, just to accept that and recognize there is some discomfort, and just breathing and focusing on the very outside of the discomfort, the very outer edges. And at the very outer edges, it almost feels neutral. And noticing that even though there is some discomfort, on the very outside, there can be neutrality or even some sense of comfort. Just allowing yourself to notice that place where it's just on the outer edges, and just breathing there and being with that, so that you can have an experience of noticing some of this discomfort and being able to titrate it by going to the very outer edges, a place that's much more tolerable to sense into, and just letting yourself breathe and sense into it, and breathing and noticing that that's there. And then we can move right into another SE tool, pendulation. You can use the same two places in your body that I've just asked you to notice. That place that is more comfortable and the outer edges of that place that is less comfortable. And with pendulation, you get to see that your body has both comfortable and not so comfortable places, and you get to move your focus from the not so comfortable to the more comfortable. So let's start with noticing that place that is more comfortable and breathing into that and just being aware of that and really sensing into that. And then very slowly shifting your attention to the outer edges of that place that was not so comfortable. And noticing that and just touching that for a moment in your mind, and now back to that place that is so much more comfortable. taking a deep breath, taking it in, this place that's either neutral or more comfortable. And then shifting your attention back for a moment to the outer edges of that area that's not as comfortable. A breath, a moment, and now shifting your attention back to the place that's so much more comfortable. Breathing in and breathing out, and you might notice that just allowing your brain to realize that there are comfortable places in your body or neutral places, even when you're focusing on a less comfortable place, this can bring even more increased comfort. So let's try it one more time, really breathing into this comfortable place in your body or this neutral place, and just really sensing into it and really allowing yourself to register that there is a place in your body that is either neutral or comfortable. And then with the breath in and out, just shifting your awareness over to the outer edges of that place that's not as comfortable. Just noticing it. And then bringing your attention back to the more comfortable place. And now, just like that picture that you had looked at where you get to take it all in, allowing yourself to recognize that although there might be some places that are not as comfortable, there's also this place, and there may now be many more than one places in your body that are more comfortable. You may notice many neutral or comfortable places. And even though there may be a place in your body that still isn't as comfortable as you'd like it to be, there are other places that are much more comfortable than when you began. And just breathing in and out, the last of the guided assignments is more from the imagery. So I'm going to ask you to use your imagination with this one, just allowing yourself to breathe. And we know that we experience discomfort because our brain is registering some sort of discomfort. It's a signal from our brain. So our brain is kind of like a control room. And I'd like you to imagine that you're in some sort of control room. If you don't see a picture of it, just allow yourself to follow along. Lots of knobs and buttons and dials, all corresponding to different places in your body. And I want you to find the dial that corresponds to a place in your body that still may not be as comfortable as you'd like it to be, even after doing many things. Find that dial. Maybe it has a label on it that corresponds to that part of your body that still isn't as comfortable as you'd like it to be. And you might notice that that dial has everywhere from 0 up to 10. And notice where the dial is right now. And that number corresponds to a level of discomfort that you may be feeling in this part of your body that isn't as comfortable as you'd like it to be. And just notice that. Whatever number it is just fine. Just accepting whatever number is there, whatever number pops into your brain, into your mind. And then with each breath, I want you to imagine that you're turning down the volume, turning the knob down, turning the dial, just like you would on those old types of radios where you actually turn the dial. Or sometimes people have dimmer switches on lights. And just imagine as you breathe in and out that the dial is beginning to move down. You want to tell yourself that as the dial begins to move down, so does your level of discomfort. You're turning down the volume. And with each breath, allowing it to become dimmer, softer, quieter. And I wonder how low you can turn that dial down. I wonder today, the first time you're trying this exercise, the first time you're trying this, just how low you can turn it down. And each time you come back to this, you can turn it down even more. Just slowly breathing in and breathing out, focusing entirely on the dial. No longer focusing on your body, just on this dial. Turning it down just a little bit at a time. With each breath in and out, telling yourself that as you turn the dial down, you feel more and more comfortable. As you turn the dial down on your discomfort, you become more and more comfortable. And you can be curious about just how low you can turn this down. Just focusing on the dial and the numbers getting just a little bit lower. And if you want to, if it feels interesting, you can experiment with different visuals, like sliding a switch down, or thermometer going down. Anything that appeals to you. As you turn down the volume and it becomes softer and it becomes quieter and it becomes more and more comfortable. And each time you try this, it will be easier and easier for you to focus on the dial, turn it down, and tell yourself this corresponds to you turning down the discomfort so that all that's left is more and more comfort. Allowing more and more comfort. And you can continue to be experimenting with this, or you can just breathe and free your mind. And you will hear the music signaling that this is the end of the program. Giving yourself time to practice each one of these to see which one you like the best and which one increases your comfort the most.